tell you the another anti-cancer drug, that is tretinoin. Right, that is tretinoin. Now if you take this particular tretinoin, right, this is called as all-trans-retinoic acid. Right, all-trans-retinoic acid. Now if you take this all-trans-retinoic acid, where is this used? This is used in the treatment of acute promyelocytic leukemia. Right, acute promyelocytic leukemia. Now this all-trans-retinoic acid, remember, it induces 70% or more rate of complete remission in case of acute promyelocytic leukemia. So remember, this particular all-trans-retinoic acid, it will induce 70% or more, right, 70% or more complete remission. Right, 70% or more complete remission in case of acute promyelocytic leukemia. Now, this particular tretinoin, it is associated with various toxicities. One of the toxicity of this all-trans-retinoic acid is your vitamin A toxicity. Right, it is vitamin A toxicity, and because of this hypervitaminosis A or vitamin A toxicity, this particular drug can cause headache. Right, this particular drug, it can cause fever, and then there will be dryness of the skin, and not only dryness of the skin, the individual can also have the skin rash, that is the dermatological manifestation, and because of the dryness of the skin, they will have pruritus, and within the eye it can cause conjunctivitis. Right, within the eye it can cause conjunctivitis. So that is your vitamin A toxicity. Now, apart from vitamin A toxicity, we have another important adverse effect, that is retinoic acid syndrome. Right, retinoic acid syndrome. Now, if you take this particular retinoic acid syndrome, remember the features of this retinoic acid syndrome, it mainly they include the fever and as well as the leukocytosis. So the features include fever, and the features, it includes increase in the WBC count, and the individual will have difficulty in breathing, that is dyspnea, and the individual can also have the property of this particular weight gain. And within this retinoic acid syndrome, there can be the pulmonary and as well as the cardiac manifestations. The pulmonary manifestations, they include pulmonary infiltrates. Right, the individual can have the pulmonary infiltrates or the pleural or pericardial effusion. Right, pleural or pericardial effusion. So that will be the retinoic acid syndrome features. Now, apart from that, this particular all-trans-retinoic acid can also cause the CNS toxicity. Right, it can also cause the CNS toxicity. So the CNS toxicity associated with all-trans-retinoic acid, it mainly includes dizziness, anxiety, depression, confusion, and as well as agitation. So the individual can have dizziness, right, the individual can have confusion, right, the individual can have agitation, right, the individual can also have depression. Alright, so these are the features of CNS toxicity. Now, apart from these particular adverse effects, this all-trans-retinoic acid will increase the cholesterol of the individual, so it can cause hypercholesterolemia, and it can also increase the triglycerides of the individual, that is hypertriglyceridemia. And apart from that, this particular drug can cause abdominal pain. Right, this particular drug can cause abdominal pain and as well as the diarrhea. Right, as well as the diarrhea. So these are the adverse effects associated with this all-trans-retinoic acid. So the multiple choice question here is, in which particular type of malignancy this is used? This is used in case of acute promyelocytic leukemia, and this is associated with vitamin A toxicity, retinoic acid syndrome, CNS toxicity, increase in cholesterol and triglycerides, abdominal pain, and as well as diarrhea. Now let me tell you the other important anti-cancer drug, that is the arsenic trioxide. Right, arsenic trioxide. Now if you take this particular drug, that is arsenic trioxide, remember this is also used for the treatment of acute promyelocytic leukemia. So just now we have discussed the tretinoic acid, that is all-trans-retinoic acid, that is used in the treatment of acute promyelocytic leukemia, and this is another drug which is used for the treatment of acute promyelocytic leukemia. Right, this is another drug used in the treatment of acute promyelocytic leukemia. Now, let me tell you the adverse effects associated with arsenic trioxide. The adverse effects associated with the arsenic trioxide is it can increase the glucose levels of the individuals, that is, it can cause hyperglycemia, and it can also cause prolonged QT interval. Right? It can cause prolonged QT interval. Next, remember, like tretinoin, it also acts as the differentiating agent. So that is about your arsenic trioxide. Now, next to this arsenic trioxide, we have one of a newer anti-cancer drug, that is 𝐒𝐿eucel-T. Right? The other anti-cancer drug, that is 𝐒𝐿eucel-T. Now, if you see this particular 𝐒𝐿eucel-T, remember, it is a cell-based cancer immunotherapy for prostate cancer. Right? It is one of the cell-based, right? It is one of the cell-based cancer immunotherapy, right? Cell-based cancer immunotherapy for prostate cancer, right? For prostate cancer. Now, where do we use this particular 𝐒𝐿eucel-T is in case of prostate cancer. Let me tell you the mechanism. Now, it is a cell-based cancer immunotherapy. Now, what is this mechanism? Let me try to explain you. Now, what we do in case of this particular 𝐒𝐿eucel-T is, like, we take the patient's antigen presenting cells. What are antigen presenting cells? That is macrophages. So the patient's macrophages are extracted by leukapheresis, and these antigen presenting cells, they are incubated with a fusion protein. What is a fusion protein in case of the prostate cancer is, it consists of the prostatic acid phosphatase and as well as GM-CSF, right? So what do we do here? Patient's antigen presenting cells, right? Patient's antigen presenting cells, they are being extracted by, right? They are being extracted by leukapheresis, right? Next, after being extracted by leukapheresis, these antigen presenting cells are incubated with the fusion proteins, right? These are incubated with the fusion protein. Now, what is this particular fusion protein? This fusion protein, it consists of the prostatic acid phosphatase and as well as, right, and as well as the GM-CSF, that is granulocyte monocyte colony stimulating factor. Now this antigen presenting cells, they are incubated with the fusion proteins, right? They are incubated with the fusion proteins. What are the fusion protein? Like, that is your acid phosphatase and as well as GM-CSF. Now this particular entire combination, that is antigen presenting cells which are being fused with the proteins, this entire combination, it is again reinfused into the patient. So this particular combination, once it is reinfused into the patient, this will cause an immune response against the tumor cells carrying the prostatic acid phosphatase antigen. So in this way, it is used in the treatment of prostate cancer. So this particular combination, that is the fusion protein and as well as the antigen presenting cells, they are being reinfused, right? These are being reinfused into the patient. So once they are being reinfused into the patient, this can cause, right? This can cause immune response, right? This can cause immune response, right, against the tumor cells carrying prostatic acid phosphatase antigen. Prostatic acid phosphatase antigen. Now remember, this 𝐒𝐿eucel, where is it used? It is approved for hormone refractory prostate cancer, right? Approved for hormone refractory prostate carcinoma. All right. So this is about your 𝐒𝐿eucel. So 𝐒𝐿eucel-T, remember, this is one of the cell-based cancer immunotherapy for prostate cancer. Now what we do in this is, the patient's antigen presenting cells are extracted by leukapheresis and they are incubated with the fusion protein. And what is that fusion protein? It consists of the prostatic acid phosphatase and as well as GM-CSF. And this entire combination is then reinfused into the patient to cause an immune response against the tumor cell carrying the prostatic acid phosphatase antigen. And remember, this combination is approved for hormone refractory prostate cancer.